Mobilising community assets to tackle health inequalities is all about recognising the amazing work that community organisations and assets and resources in our communities do for supporting the wider health of the public, particularly around health inequalities and particularly for people living in the poorest areas who are experiencing those inequalities. So community assets refers to any organisation, individual, network or resource in the community that can be described as an asset. So it might be our parks, our libraries, our museums, or for example youth clubs or charities that are supporting the community. And what we're interested in is how those organisations and individuals and resources can collaborate more effectively together to support the poorest people living in the poorest areas.
So community assets are really important for the NHS. What makes us well isn't just what goes on inside the NHS. If you consider the social determinants of health, a lot of the environment that people live in, the communities that they live in, are really determinant in regards to their health and well-being. One of the things that we recognise is that whilst we're living longer lives, we're not necessarily living healthier lives. And a lot of the social determinants of health really create health inequalities for individuals living in various communities across the country. So whilst biomedicine, drugs, medications, surgical procedures create lots of opportunities to support people, actually the complexities that we live with now need wider approaches. And some of those approaches can be found in the communities around us.
So a really important part of the programme is about that collaboration across community organisations, but with those wider organisations and services that support the health of the public. So that includes our health services, it includes social services, and those wider statutory services. So what we're interested in is how can those two quite complicated ecosystems work more effectively together, particularly targeting inequalities and deprivation. So we're in the third phase of the programme at the minute, and we've already funded 2 rounds in phase 1 and phase 2, and our funding has been distributed all over the UK, and we've been finding some really interesting things. So one of the key aspects of the programme has been the importance of the co-location of services, so organisations working collaboratively together to think about how they best target those most in need in communities. So we've seen really interesting examples, museums working with food banks or working with people providing free legal or social welfare advice or debt advice. So collaborations that might not necessarily be obvious in the first instance, but actually are really thinking about those wider needs of society. Arts and humanities research is really important, I think, for addressing some of these wider issues around, for example, the economic and societal benefits that we need to address in terms of the health of the public. Using arts and creativity and employing creative community researchers to help understand how to bridge those gaps.
So I'm really optimistic about the opportunity for a community-based health to be combined with approaches in the NHS. The NHS has made big commitments to the rollout of social prescribing, and as a consequence of that, we're starting to see more psychosocial support alongside biomedical interventions, and I think that creates the opportunity for some really good health and wellbeing outcomes to be achieved.